Hi, this is Dr. David Gilpin, and I would like to discuss with you one of the questions we hear quite often in our practice, and that is, am I ready for a facelift? So this question can really be asked in one of two ways. Number one, as we've already said, am I ready for a facelift? Am I too young? Am I too old? The second way to ask it is, doctor, I know that I'm ready for a facelift, but I just don't think that it's something I want to do right now. I don't think I'm old enough. It's just not something I want to undergo, and I want to put it off in a few years. So let's take a look at both of those situations. So firstly, am I ready for a facelift? A great test to do even at home is take your index finger and thumb and in front of the mirror, lift just like this. And if you see an improvement in the mirror, you like what you see, then most likely, at least anatomically, you're ready for a facelift. Now this doesn't mean you're necessarily emotionally ready for one. Facelift is a surgical procedure. It does have downtime. We typically say anywhere from 9 to 14 days in our practice. Typically we'll do it under general anesthesia, but you can also have it done under IV sedation with local. And it also has risks. So all of these things must be considered when thinking about surgery. The second part is, well, doctor, I know that you've recommended a facelift to me, but it's just not something I want to do right now. I'd like to wait a few years. So a few considerations with that. Number one, as we age, the face, especially the laxity and the jowling here, they don't necessarily improve. So I tell folks, don't necessarily expect things to necessarily get better as years go on. The second thing is that we typically don't get healthier as we age. So if you're healthy enough today to have a surgical procedure, then it certainly should be a consideration to doing that now versus later. But we never want to use that as any sort of pressure or any sort of coercion to undergo a surgical procedure. Just something that we need to consider. There really aren't any, quote, age limits on the procedure. We typically see folks who are around the age of 40 or older before we really consider doing this procedure. And as long as you're healthy, there really is no upper age limit. We have many patients who are in their upper 60s, their upper 70s, who've undergone this procedure without any issues, and they're very happy. The most important thing is to remember to come in for a consultation so we can have a look at you and we can discuss all of your options in which procedure is best for you. Thank you so much for listening and for your attention.